Ketogenic therapy or medical ketosis is not the same as a regular keto diet. So what's the difference? I'm Dr. Bret, Scher, Director of Metabolic Mind. Let's explore this question and see what it may mean for you. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Ketogenic therapy, or medical ketosis, is the purposeful use of the physiologic state of ketosis to treat a specific medical condition under the guidance of a healthcare professional. Now that's a mouthful, and while that likely includes eating a ketogenic diet, the specifics and intent differ from your average keto diet. But before we discuss this further, please remember that our channels for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision, so please consult your healthcare provider before changing your lifestyle or medications. Now, whether you're considering ketogenic therapy to reverse type 2 diabetes, eliminate seizures, treat an autoimmune condition, or put bipolar disorder into remission, most experts recommend approaching it as ketogenic therapy under the guidance of a healthcare professional. Now, to understand why that's important, let's first define a ketogenic diet. A ketogenic diet is any pattern of food consumption that allows your body to switch from burning glucose for fuel to burning fat for fuel. And in the process, the liver creates ketones. Now, this can be fasting or eating a very low-calorie diet. It could be a vegan or vegetarian diet, omnivore, Mediterranean, carnivore, or any diet in between. They can all put someone into a state of ketosis when properly designed. Now, when it comes to weight loss, which is likely the most popular reason someone hears about or tries a ketogenic diet, people can see significant benefits at different levels of ketosis or even by eating low carb without achieving ketosis. So someone may say that they went keto and it worked and they lost weight, even if they weren't truly in ketosis. But that same strategy of just reducing carbs and increasing fat may not be enough to reverse type 2 diabetes or treat a serious mental health disorder. That's why when we hear someone tried keto and it didn't work for their health condition, our first question is if they tried ketogenic therapy with a healthcare provider. And that may sound actually like arrogant, right? Like saying if it didn't work, they must have done it wrong. But that's not what we're saying. Ketogenic therapy likely won't work for everyone. We have to acknowledge that. So it's not an assumption that it will work for everyone as long as they do it right. No, not at all. Instead, it's knowing that most people define going keto in a less rigorous way than we define ketogenic therapy, and most experts define ketogenic therapy. So before someone says that ketosis didn't work, we want to make sure they tried ketogenic therapy. And then if it didn't help them achieve their health goals, they can say they gave it an adequate try and move on to try something else. So here's what that may look like. If someone wants to treat their bipolar disorder with ketogenic therapy, they will start by seeing their treating physician to make a plan. And they get a thorough initial assessment with blood work, including some non-traditional tests like a fasting insulin level, carnitine level, B12, vitamin D, TSH, and others. You can watch our video on blood work to get when starting ketogenic therapy for more information. So they work with their doctor or their dietitian, therapist, or coach to understand how to start a ketogenic diet, what to look out for medically, and then if, how, and when to adjust medications, what to do if they develop any unwanted symptoms, and more. You can watch our videos about managing psychiatric medications with ketogenic therapy, and another one on how to mitigate the risk of hypomania when transitioning onto a ketogenic diet. These are important topics to review with your healthcare team. Now, they also will monitor their ketones regularly and work with their provider to develop a target ketone level and adjust the diet and lifestyle to achieve that ketone goal. So that can include macronutrient changes, adding MCT oil, intermittent fasting, or other strategies. They'll continually monitor for clinical progress or lack thereof and adjust their lifestyle or medications as needed, and when appropriate, address other metabolic factors like sleep and stress management, physical activity, just to name a few. And this is just the beginning. So as you can see, ketogenic therapy or medical ketosis is much more involved than just changing your diet. That's why we and most experts in this field strongly encourage everyone to work with an experienced clinical team to give them the best chance of finding an approach to achieve their health goals. And if you're looking for a clinician to help you, please realize that it can be a physician, but it can also be a dietitian, therapist, health coach, or other experienced clinical provider, as long as they can help coordinate care with the treating physician and make sure the physician is an involved part of the team. Now, some people have found success locating experienced clinicians with the directory at diagnosisdiet.com/directory. I hope this helps you better understand the difference between ketogenic therapy and simply starting a ketogenic diet, and what we hope people try before deciding whether or not ketosis helped them achieve their health goals. Thank you for watching. I'm Dr. Bret Scher, and this is Metabolic Mind, a nonprofit initiative of Bazooki Group. If you found this helpful, please take a moment to like and subscribe, and please share this video with anyone who you think it may help. And leave us a comment, as we love to hear your experiences with ketogenic therapy. Thanks again for watching, and we'll see you next time at Metabolic Mind.